more hay.
So you're irrigating him some more then?
I am, because now that we have his mouth open, there's some more hay in there that can come out. So you start looking in there. I'm not sure where you can see.
I can see all the way back there.
So if you look on the outside of the uppers, there's sharp edges. You can see how pointy they are. And then on the inside of the bottom, they get pretty pointy. And then you also want to take down some on the biting surface, and just so that it's not as rough, but you don't want to make it too smooth, because if you make it too smooth, then they no longer can chew and grind up their food.
So the point of all this is not really just have clean teeth, it's to have a
Right.
bite that is able to function and chew
Exactly.
his hay properly.
Exactly. You know, we don't do as much for cleaning and, you know, aesthetic looks, but more for function and safety, and also for, you can see his, I'm not sure if you can see on the camera, but his cheeks tend to get a little bit roughened, some ulcers, just from the sharp edges of the teeth.
Gotcha. Now what happens to horses in the wild that don't have this done?
They don't live as long. So horses in the wild, you're looking at like 15 years or so. They also continuously graze, so they're eating grass and eating grass down to the sand where it kind of grinds their teeth a little bit better. But they also don't live as long. You know, with modern medicine, we can do quite a bit more for horses, and they live, you know, into their 30s and 40s, whereas in the wild, they're not living near as long.
Is there an average life expectancy of a horse that's well taken care of?
Usually within their 30s and 40s. I mean, I actually just put down one of my horses that was 33, and so, you know, they're living a lot longer now that we know better how to take care of older horses, and we know what to do for them. And when they, you know, when they get to a point where they can't chew properly, then we know how to feed them better, so that even though they can't chew properly, they're still getting the nutrition that they need.
Are they still rideable to a certain age, or you know,
Yeah, and it's on a horse-by-horse basis. You know, there's some horses that get so much arthritis that, you know, it's not fair for them to ride. But then there's some horses, if they're doing well, can ride into their 30s because they like the job. I mean, you're not going to be competing them hardcore, but, you know, at least getting them out and getting them some exercise, and they usually feel a little bit better.
So they become senior citizens who are in good shape, have a good quality of life.
Right, exactly.
And we're seeing that in our human population, that more exercise, better diets, drug therapy, prevention works.
Supplements. In horses we use a lot of joint therapy, so glucosamine and MSM, which a lot of people take as well, and we find good results with horses.
Are those particular products good preventive products?
Yep, definitely.
Okay. So really don't wait till your horse has joint issues, just get it on him.
Right, if they start getting up there in age, then it's a good idea to do it. So you can see we're taking off a lot of the enamel there, and each float that I'm grabbing has a different angle to it to get certain points.
Which is that product called a float? Is that what it's called?
Right, this whole thing is called a float, a dental float.
Okay.
This is the blade here, and again this one's a carbide blade that only goes in one direction. So as I'm pulling, that's when it's taking off the thing, or all the enamel points. So as I go back and forth, I'm getting a good rhythm going to take off those enamel points. And this one's bent forward, kind of back a little bit, so that I can get up on that angle of the tooth row.
And this is done once a year. Is that often enough?
Once a year. Older horses and younger horses sometimes need to be done a little bit more often. So every 6 months maybe check. But that's, you know, depending on the horse. There's certain horses that have issues that need to be done every, you know, 4 to 6 months. So horses that have a known issue, something like that, just to kind of make sure that everything is going okay.
Is there anything you do after using the float?
If we wind up changing a lot in the mouth, then what we do is we will give them some anti-inflammatories. So butorphanamine, which is a similar drug to Aleve or Advil. And so we can do that for just to make them feel better so that they're not swollen, so they eat better. Some horses, if we do a lot of work in their mouth, then they tend to be sore and they don't want to eat. So on him, this is a routine maintenance float, so it's not going to be a lot of straining pressure or anything like that.
Now, you're floating. Are you going to check for cavities or gum disease of any kind?
I'm going to look and see, and what I'll do is I'll poke in there around, see if there's any soft spots, kind of like a human dentist would do, and see if there's any teeth that are loose, any cracks, anything like that. A big thing is we see a lot of cracks, cracked tooth. We'll see where they've broken off a piece of the tooth, and that's a good place where food can get packed up in there and cause a tooth root abscess, and that's a big thing that we see.
And you see that more often because of the diet that humans are giving them? Or because it's just natural attrition, chewing on a rock or something?
Yeah, if they chew on something, sometimes they'll just, or if they get kicked by another horse and break a tooth, sometimes you won't see anything on the outside, but they will have broken something inside. And a lot of times you won't notice that until you start smelling either a foul smell or you get a discharge down the nose, because a lot of the roots are in the sinuses, so when there's an abscess in there, it kind of comes out the nose. Or underneath, we'll see a swelling on the jawline.
Now, you were telling me that horses get cavities nowadays because of
a lot of treats. So they're getting sugar treats, things that they're not used to getting. They're getting sweet feed that has molasses and sugar in it, and you know, I mean, a lot of things that horses just aren't used to doing. So I'm just going to give him just a little bit more sedation, just so that we don't get the head throwing and I can get in there and get a much better job. So I'm using just a little bit of detomidine.
And when you give that to him, it's IV?
IV, yep, in the vein. That's the fastest way to do it, and more direct. If we gave it in the muscle, it would take quite a bit longer to take effect and wouldn't work quite as long.